so this is skin, light and fluffy. You know these three characters? Who's this guy? Freddy Krueger. We're going to talk about Burns, okay? So that's why I put them on there. Who's this guy that, you know, he looks a lot older than what he is? Well, now he's older, but you know, Rolling Stones? Keith Richards. Yeah, Keith Richards. And who's this? Or who's this going to be, maybe, let's say, 50 years from now? Yeah, that's Julia Roberts. They did some kind of wrinkles on the person and stuff. Nowadays, they have these apps that you could actually take a picture of yourself and you could see what you look like at 50 years old or 60 years old and stuff. So I guess that's how they came up with it. So it's all about skin, okay? So the integumentary system, which is skin and all its accessory organs. Some of this we dealt a little bit because it's all going to be about the stratified squamous epithelium from histology. This is considered our largest organ in our body. Okay, you think of the whole thing. It's our first line of defense against the environment. So if a bacteria wants to come inside your body, you have to have good skin to protect yourself. All right. If you have a big opening there, a cut or whatever, you just open a doorway so that bacteria can come inside. If you have gangrene, we'll talk about that later, if you have where the tissue, the skin starts deteriorating for whichever reason, frostbite, because you're diabetic or something like that, well, that's going to tear away at some of the tissue, the skin tissue, and again, you're creating a doorway to allow bacteria to come inside. Think of this as your house, okay? The walls of your house, the roof of your house is the skin. If you put a hole in the roof or a hole in the wall, you're going to allow rats and other bugs to come inside. Works the same way. It's a first line of defense when we deal with the external environment. Okay? Functions. There's a bunch of things here. We're going to talk about all these. It's going to protect their underlying tissues, maintain body temperature. It's going to synthesize vitamin D3, which we've kind of already talked about with bones. It's going to store lipids, detect touch, pressure, so it has sensory to it also. We're going to talk about all that as we go along here. Okay? All right. The skin is going to consist of a cutaneous membrane. Okay? Cutaneous membrane has a few parts to it. We have a part called the upper, or the most superficial area is called the epidermis. The epidermis is made of a stratified squamous epithelium, and you've seen that, a lot of layers. And this is in the skin, it's going to be keratinized. We'll talk about what keratin is a little bit more in depth in a few moments. It also deals with the dermis. Epi means most, or outer layer, or outer something. Epi, that's what the prefix means. So you have the epidermis, and going deeper down, we have something called the dermis. And the dermis is broken down into two things. Something called the papillary layer, which is areolar connective tissue, and reticular layer, which is dense irregular connective tissue. You see why you need to know about histology to deal with these other things. So if you didn't do good on that first test, it's going to reiterate itself. You can't get away from it, but it's going to reinforce it, saying, oh, this is where it's found. Now I remember where it's found. What makes skin a little bit easier than the other systems is that mostly it's dealing with layers. For instance, you can already see the dermis is 2 layers, and what you don't see up there yet is the epidermis is actually 4 or 5 layers, and we'll talk about those. So that's a cutaneous membrane, which is made up of the epidermis and dermis. You also have the subcutaneous tissue, which is found underneath the dermis, and this is also known as the hypodermis, and it's also referred to as superficial fascia. Yes, in order to master A and P, you need to know how to say one structure about, in this case, 3 different ways. They all mean the same thing. Subcutaneous tissue, hypodermis, superficial fascia. I can't just talk about it as hypodermis and then you're going to be taking A and P2 and they refer to it as a superficial fascia. It's not going to make any sense. So you need to know all 3 forms of it. And this is mainly adipose tissue. What is adipose tissue? Fat. Yeah, so you're going to have fat underneath there. It's going to store a lot of energy. So it's not actual skin, but it anchors the skin to the underlying organs. Okay, the skin is really the epidermis and dermis. This hypodermis is really the connective tissue between the skin and the underlying tissue. Okay? So if you look at this, we'll go through the parts in a moment, but this is your skin. These are hair follicles sticking up. And what you have over here is the epidermis, very thin layer, but there's a lot of layers in there, and we'll talk about those. Then you have this pinkish area, which is going to be the dermis. And that's broken down to the upper layer called the papillary layer, and the lower 4/5 of it, which is going, or 2/3 of it, is going to be the reticular layer, the thicker layer. Underneath all of that is this yellowish area, the fat, and that's going to be your hypodermis area. Okay? So we're going deeper in there. If you want to see on a histological view, again, epidermis is this area here, dermis is over here, and the hypodermis. Between the epidermis and dermis, there's a distinct delineation between the two. You can see a line there. However, when you get to the dermis and hypodermis, it kind of just overlaps. You can't see a distinctive line between the two. But you can see all this adipose tissue in this area here if you get up really close. So, routes that medications can be given to you. Now you can put some applications to this. We could put a patch, a transdermal patch, where you put it right on the skin, and the medication transmits it through the skin itself. You could do a subcutaneous. Now you understand what subcutaneous is. You put it in the fat, the hypodermis area. Or you can actually put a needle in an intramuscular area, so it's going to go through all the skin, all the hypodermis, right into the muscle. So you have an idea of all this. This is just showing you, if you want to, you really can't separate it like this, but it's just a schematic view so that you can appreciate the the epidermal area, and here's the dermal area. Okay? And you're going to see things that kind of go in from the epidermis. These are called epidermal ridges, but then you have the dermal papilla that kind of stand up like spikes. Again, you can see that, right? The dermal papilla going up here, and the epidermal ridges, which are going down like this. All right, same thing.
Is that just like a connective mechanism?
Mm-hmm. Yep, absolutely. What's happening over here, this is epidermis, there's the basement membrane that's going to separate those two.
Same as like microvillage, increasing surface area, kind of, to allow for a greater connective.
No. It's just, it kind of sets, why they're like that, it kind of creates, if they were smooth, I would believe that the epidermal skin will, or epidermal area layer will come off. But because they're the ridges, they stay together.
Okay.
All right? I see what you're saying. There's more surface area over here, so you can have more hemidesmosomes going in all this as opposed to one flat. So, yeah, I can see what you're saying. You're absolutely right. That it's given more surface area, not for absorption, but because we could put more of the hemidesmosomes to make the basement membrane attach to the connective tissue. Mm-hmm. So let's talk more about the epidermis, and then we'll go into the dermis, lightly hypodermis, and we'll go into a few diseases. So the epidermis, all right, which is stratified squamous epithelium, okay? There's no blood vessels there. It's not vascular. So how do the epidermis doesn't have blood vessels there, but underneath, the dermal area, the dermal layer, has its blood vessels. So how does the epidermis get its nutrients? I'm sorry? Diffusion. It's going to go from a high concentration of oxygen and glucose that's found in the dermal area, and when you get to the epidermis, there's not much oxygen up there. So it's just going to go from a high concentration of oxygen, diffuse up to a low concentration of oxygen. So that's how the epidermis gets its nutrients, is through simple diffusion from the underlying blood vessels in the dermal area. God bless you. Okay? Cells grow and divide upward. And if you have too fast of a mitosis that's happening, you'll get dandruff, right? The skin falls off. So there's less nutrients at the surface area. It's going to be where the bottom area of the epidermis is that's going to get the most of the oxygen and glucose. By the time you get to the top, it's not going to get that much oxygen. Okay? So it takes 5 weeks. If we're going to go from mitosis from the bottom to the top, it takes 5 weeks for that new cell to actually come off your body and flake off. Okay? Now, let's talk about keratinization. There's a protein called keratin that enters the cells as they move up in the epidermis. Remember, we're just talking about the epidermis at this level now. And this causes the cells to change shape as they move up. It makes the cells more water resistant, so it doesn't lose its water. It stays in there. Calluses. Where do calluses come from? Calluses is that the keratocytes, there's cells in the epidermis that make keratin. They make a lot more. Because as you're doing, I don't know, think about you're putting a screwdriver, you know, you're putting a screw in a wall or whatever, and you're doing, let's say, 100 of them. You're putting more pressure, more heat in your hand. And that heat is going to heat up your body in that area. So you want more water to cool down that spot. So water is going to be made there. It's going to be wanting to stay there. So the keratinocytes at that point are going to make more keratin to keep the water sustained in that area, to cool that area every time you screw in a screw. Does that make sense? Okay? If they happen at a bony area, let's say you're rubbing your shoe, if you're wearing a lot of, let's say, high heels, and every time you're walking, the bones of your toes are rubbing against the shoe at where your point is of the shoe. Now you're doing it all day long. Sure, there's rubbing going on there, more heat. So what's going to happen here is that because there's a bony area, it can't give, it just forms a corn. Just a certain area, almost like, it looks like, you've seen corns, right? They're kind of like a certain, it almost looks like a mole. But that's what that is. But it goes away. All right, moles usually won't go away. This one would. Now, the surface layer, cells are flattened due to the keratin that's added. Okay? They change shape as they go up in this epidermis. And soon, the skin cells will actually come off. We call this exfoliation, right? Also known as desquamination. So cells, as they move up, they eventually die and they slough off, or they go off. And it's due because there's not much nutrients up at the top layer. It's going to be found deeper. Now, thick skin, namely the palms of your hands and soles of your feet, have 5 layers in the epidermis. Because those are the areas that are going to be traumatized more than any other place in your body. Again, physiology reflects anatomy. You expect to have 5 layers, a thicker and extra layer in the palms of your hands because you're going to pick up hot things. You're going to walk on rocky things or glass or something. You would expect that there's going to be more of a protection there. So let's throw in an extra layer. So there'll be 5 layers that we're going to go through, 5 layers in the epidermis found in this thick area. The thin area is only going to have 4 layers. It's missing 1 layer, something called the stratum lucidum. That layer is gone. And that's where most of your skin is. It's going to be thin skin. So here are your 5 layers of the epidermis. Going from bottom to top. The most basic layer is going to be, and it sounds pretty easy to understand, stratum basale. It's also known as the stratum geminitivum. Same thing. Okay? Then as we go up, stratum spinosum, spiny layer, the cells there kind of have like little spines on them. Then you got the stratum granulosum, which is grainy, has little specks in them. Stratum lucidum, which is a clear area, which makes sense. Lucent means clear, you can see right through it. That's the part, that's the layer that is not in thin skin. It's only in thick skin. And then the uppermost layer is going to be stratum corneum. Has like a little horn to it. You'll see about that. Okay? So you should know those order, that order there. I used to know mnemonics. I don't know, Barbara Streisand goes, I don't know, something, come up with some mnemonic to help you with that. So when you look at the epidermis, again, this, so from this purple area here all the way to the top, this is the epidermis. This yellow area here is going to be the dermis. We're not talking about this area. We're talking about from here all the way up. And this is broken down into 5 different layers. Okay? And I'm trying to show you on here. On a histological view, you can see them on here. All right? Going here, the stratum germinativum, which is the stratum basale, which is down here, and move it all the way up. Stratum corneum is the uppermost layer, and that's the thickest most layer. That's the part that is going to eventually shed off.
Why do some people never get rid of calcium?
Because it's still there. In other words, they're still creating that pressure there. And that's why it's there.
I have some that will go away,
Mm-hmm.
but I can like feel like one right here.
Down deep, right?
No. I can feel it like going off. As soon as I go to work, I must distract it way off from that.
Yeah. It's because of the heat that's creating in that particular area. Gloves will actually, not rubber gloves, but like the thick gloves, will actually make the cushioning better on those areas. Creams will actually soften that up too. But creams aren't really a big thing. It's more like the gloves. You know, when you're doing a lot of shoveling, wear gloves. You won't produce those corns or those calluses. Okay. All right. So let's go through a little bit of the features of each one of these layers, going from the bottom to the top. So the stratum basale, all right, which is the same thing as the stratum germinativum. One layer thick. That's it. There's only one layer there. Okay? Most mitosis occurs here. And when this happens, one cell will stay there and one will move up. Similar to what you saw with the epiphyseal plates, all right, in bones. If you haven't gotten there, that's fine. But understand that one cell, if this is going to be your stratum basale, when this cell goes through, and let's say this is the going up and this is going down. When this goes through mitosis, one cell will be over here and one cell will move up. Does that make sense? So there'll always be one layer of cells here, but this is how all the cells move up. Okay? So this is right next to the basement membrane. So it's the one that's going to be closest to the blood vessels. Remember, the blood vessels are down here in the dermal area. So these are the ones that are going to get the most nutrients. We also have melanocytes located in the stratum basale. Melanocytes is going to make up about 25% of this layer, and it's going to release a chemical called melanin. Melanin is a dark brown or black pigment, and it absorbs the UV light from the sun so that it doesn't go all the way into your skin and destroy, not skin, but in your underlying tissues and destroy them. So it protects the DNA from undergoing mutations from this UV light. The more melanin, the less likely you're going to have mutations in your skin. Everybody has the same number of melanocytes. I don't care what color you are. Everybody has the same number of melanocytes. So what makes someone have a different skin color than another? It's the amount of activity that these melanocytes produce and release melanin. For instance, African American people produce more melanin, and albinos don't release any melanin at all. But they have the same number of melanocytes. Okay? sunlight, I abbreviated with SL, produce more melanin. So you have sunlight, it's going to produce more melanin and give you that darker color. If you have a prolonged exposure to sunlight, then what's going to happen is the melanin is unable to absorb the UV light and you get sunburn. They can't function. They get destroyed. As you learned about before, sunlight's important, not to make you darker, okay? Although that's more of an aesthetic property. But you need the sunlight because it converts cholesterol into vitamin D. Okay? And you only need 45 minutes of sunlight per week to make this, per week. So if you think about it, when I see my doctor in February, he's telling me my vitamin D is very low, so he wants me to take more calcium. Fine, but you know what? It makes sense. It's not like I have a disease. I'm not wearing tank tops in February. Does that make sense? I don't have low levels of vitamin D when we deal with the summer because I'm wearing my tank tops or short sleeve shirts. So you got to think about that, right? It makes sense. Like I said, you need about 45 minutes a week, not a day, a week. Okay? And the vitamin D is then stored in the adipose layer, the hypodermis layer, and it's going to be needed to help absorb calcium from our diets. Okay? Now, our second layer, moving up in the epidermis, is going to be stratum spinosum. And this is several layers thick. These cells have like spiny processes to them. And there is mitosis going in here, not as great as the stratum basale, but it's there. All right? And one cell during mitosis goes up and another one moves down. Okay? Well, not move up, it stays in that level, kind of like doing this thing here. Stratum granulosum, there's 2 to 3 layers there. Cells appear grainy, has those little grains in it. Granules, that's why it's called granulosum, grainy. Okay? And this is where keratinization begins. Again, keeping the cells more water resistant. That's where this takes place, is in the stratum granulosum. The stratum lucidum, you can see right through it. Again, think of lucent. It's only present in thick skin, i.e. the soles of your feet, the palms of your hand. An extra layer there. And there's no nucleus in these cells over here. Okay? It's an extra protection for those areas. The last layer, the uppermost layer, and that's going to be the biggest layer that we have there, 75% of the epidermis is going to be the stratum corneum. It's about 20 or 30 layers thick. It's completely keratinized. These are flattened dead cells because these are the areas that get less nutrients because they're most superficial. By the time you get to the very top, the cells are very flattened. This is why the whole epidermal layer is known as stratified, many layers, and the uppermost layer is flattened, so we refer to this as stratified squamous. And it's there for protection. So again, that's where the different layers are as an epidermis overview. Okay? Now let's talk about the dermis. Dermis, there's only 2 layers there. But there's a lot of other accessory organs found in here. It's deeper and thicker than the epidermis. And just to give you an idea, I won't ask you about this, but this is just an FYI, that animal dermis, that we treat it with a certain kind of acid, tannic acid, it causes the collagen fibers to become very tough. And this creates what we call leather. So the leather comes from the dermis of the integumentary system of the animal. Try and say that to your family. Oh, I know what that is. That's not leather. That's actually adding tannic acid to the dermal area of the animal of the integumentary system. So you stay in school, you're learning a lot. Okay. There's 2 layers, as I said, reticular layer and papillary layer. Okay. So again, showing this. We just knocked off the whole epidermal area, which is up there. But now you've got this dermis area. The upper area, which is going to be smaller, is going to be the papillary layer. And then down here will be the reticular layer of the dermis. So the reticular layer is the lower 4/5 of the dermis. All right, so 80% of the dermis is going to be reticular. This is where we're going to have blood vessels, nerves, hair follicles, sebaceous glands, sweat glands. We also have piceal corpuscles there. It's a pressure receptor. Whenever someone's pressing on you, it's the piceal corpuscle that's getting activated. Piceal corpuscles, they're also called laminated corpuscles because they look like a sliced onion. When you look at them, they like to have these concentric rings on them. We have dense, irregular connective tissue found in here, which are bundles of connective tissue that run in all different directions, right? You learned about that. All right, and that gives an extra strength to it. We also have cleavage or tension lines that happen here. This is really for the surgeons to help out when they got to make incisions. You don't want to have a scar there, so you have to go with these tension lines. If you go against the tension lines, you're going to have a scar there. And it's up to the surgeon to know where these tension lines or cleavage lines are. And I'll show you what I mean by that. You ever hear stretch marks? It's the collagen fibers in the reticular layer that get torn. That's what causes these stretch marks, or what we really call striae. So these are your cleavage lines. They're all over your body. They kind of go where your wrinkles are. And surgeons will just, through their skills, they can figure out where they go. And it's best to suture go in parallel with these lines. You can see the lines going over here. So if you put a cut this way, it's going to leave a scar. It's going to put more tension there. As opposed to going with the lines, there's less tension. Does that make sense? All right? That's the significance of these cleavage lines.
You know what chiropractors try to manipulate?
Chiropractic more of the bones and the, well, connective tissue in the sense like ligaments,
Yeah.
but not the skin per se.
Something like a
Yeah.
line we try to manipulate.
No, I think it's where the muscles, the grains of the muscles, they're actually pulling that way, not in the skin. Okay? All right, the papillary muscle, or I'm sorry, the papillary layer of the dermis. This is the upper 1/5, the thinner area of the dermis. And this has capillaries there, little blood vessels. You also have loose areolar connective tissue. That's why I said don't worry so much about the exam that we have with histology. These words are going to pop up over and over, and you'll start getting to understand why these are there. Okay? Fingerprints. This is where your fingerprints lie in. It's in the papillary layer of the dermis. The whorls of ridges that provide some friction. If they were smooth, you wouldn't be able to pick up this paper, just slide out of my hand. So fingerprints are not just for the O.J. Simpson kind of thing, although they use DNA instead. But it's there for a real reason. They're there so that you could actually pick up, they provide some sort of friction. And the pattern, as you learned probably in kindergarten, the pattern is different for each person, including identical twins. And for some weird phenomenon, when you burn your skin on your finger, and you burn the fingerprint there, when it regenerates, it gives you the same fingerprint you had just before. It's programmed in there. It's not a new format, unless of course there's a scar there, right? You cut yourself, then yeah, then the swirling of the fingerprint does get disrupted that way. You also have something called Meissner's corpuscle, not piceal corpuscle, that's the pressure receptor. This is Meissner's, and it deals with tactile. Not so much pressure, but if someone is going to, whether it's something soft, like a light touch, like a cotton ball on you, you can feel that, you can sense that. Or you can sense a smooth area here versus sandpaper. that kind of thing. Not so much pressure with what you're actually feeling. So again, just to show you, papillary layer, the upper 1/5 is up here, but the thicker 4/5 of the dermis is going to be down here. Let's talk about the hypodermis, and then we'll get into the accessory things, hair follicles and these little things that cause goosebumps and stuff. We'll get into that. So the hypodermis, all right, also known as subcutaneous layer, also known as the superficial fascia, same thing. It consists of loose connective tissue and adipose tissue. Okay? Adipose tissue is going to help cushion and heats the underlying organs. We expect that, right? Adipose tissue stores lipids, fats, energy, heat. Okay? And it's also the part that's going to be responsible for giving us those wonderful contours throughout our whole body. Okay? Whether you're voluptuous or not. This is what gives it that. Okay? This is also the part where when you have liposuction or liposuction, they're going to remove that hypodermis in those areas and sink in your cheeks or the belly or whichever. I'm pointing to my love handles. Not that I have love handles, right? I don't. Okay. All right. So again, just showing you the 3 layers. Epidermis is up here. Dermis is over here. There's a big distinction, delineation between the epidermis and dermis. Down here where the hypodermis is, it's difficult to actually see what the delineation is between the dermis and hypodermis.
So within the hypodermis, the adipose tissue, is that going to be continuous throughout, like, the way the pictures show it, shows like the dermis drops down into the hypodermis. Is the hypodermis itself just basically a layer of adipose tissue, or is the adipose
It
tissue
is, but
up
it's
here?
difficult to actually see. Like this one, like I said up here, you see a nice delineation between the two. This one's not so. It's kind of like,
Irregular.
yeah, it's kind of blended in there. When you take green and red Play-Doh, and if you just put like a layer of red Play-Doh on top of the green, there's a delineation there. But think of it as like it's swirling in between. It's like meshed in there. You can't pull them apart. Okay, there's not a good delineation between the two. Okay. Questions on this? All right. And again, this chart you can do on your own. It's basically everything I said, but basically a description of all the different layers that we just talked about. There it is in like a nutshell, at least an overview. Okay? All right, so let's talk about the accessory organs of the skin. All right? So glands, and we talked about this, so I'm not going to bore you on this. You know the difference between an exocrine gland, exocrine gland and an endocrine gland. The exocrine gland we talked about in histology has a duct, whereas the endocrine glands do not have a duct. Okay? Describing glands, we talked about this too. We had unicellular versus multicellular. Is it one cell or many cells that make it up? We could say that it's simple, where it's a duct with no branches, or we could say it's compound, where it has many branches. We could talk about the glandular area. Is it globular, or is it the same diameter as the duct itself? Is it tubular versus a center/alveolar? And we had these wonderful pictures to show you over there. You see where there's a lot of overlapping. If you didn't get it correct on the first exam, then you have another chance to understand why this stuff's important over here. Same thing with American gland, and we have the same pictures that I put in here that I do with histology. So I'm not going to bore you with that. We did that in histology. It's just reiteration because it's going to be coming up again in this chapter. Okay, showing that. But now let's go into, we talked about sebaceous glands, which one it was. But what is a sebaceous gland? Well, this is an oil gland. It's exocrine, so it has a duct. It's found in the dermis, and it secretes something called sebum. Okay? Sebum is going to, this sebaceous gland goes into a hair follicle through a duct, and the sebum is an oil, and it's going to coat and protect the hair shaft so it doesn't stay dry. It gives that, that's why sometimes your hair is too oily. It's producing too much of the oil from the sebaceous glands. And there is a bactericidal chemical in there, all right, an antibacterial thing. It's not the best, but it does take out some of the bacteria should there be anything lying around that area. And it's stimulated by sex hormones, which is what you would expect. Okay? Starts, hairs start growing in areas, what I'm talking about, right? It's decreased in the elderly. So that's why the elderly have very dry and brittle hair, because these sebaceous glands are just not secreting as much as it used to. So the sebaceous glands that we're talking about, this is a hair follicle over here. The sebaceous gland is actually connected to it, and it's going to coat that hair follicle as it grows out. Again, this is the dermal area over here, the dermis, and that orange area is going to be the epidermis. The sweat or sudoriferous glands, they're found everywhere, except, big hint. All the following are true, except, right? Except. That's what I'm saying. Catch on to those words. They're going to help you on exams. So these are found everywhere, but not the lips, certain parts of the external genitalia, and the nipples. They're most numerous in the palms and in your soles of your feet. That would kind of make sense this morning when you took the exam and you saw that your hands were getting very clammy, very sweaty, but maybe not your shoulder or your lip, right? So we have two types of sweat glands, merocrine versus apocrine. Right? And we talked about those different types. The merocrine sweat gland is more numerous, and it's a gland that's coiled up. The tube itself, the duct itself is coiled. And I'll show you what that is. Or not the gland, not the duct. The gland itself is coiled. I'll show you a picture of that. And this is found in the dermis. The sweat pores at the surface of the skin from the duct, so it's going right up there. And the secretion is usually water and salts. It's a cooling mechanism. That water is holding on to a lot of heat. So we need to, it kind of attracts the heat, and then you want to pour it out of your body. So it's a means to get rid of heat, i.e., that's why you sweat in a 100-degree temperature. The apocrine sweat glands, those are actually larger, and they're going to be located in the axilla, right? The armpits, and also the external genitalia. The ducts here are open to the hair follicles, not to the skin itself. And it's stimulated by sexual arousal, pain, and stress. The secretion here is not just water and salts, but we also have fatty acids and proteins that come out. Now, what is BO? Body odor, right? Not a very pleasant smell, at least in our culture, right? But what it is that when the sweat comes out of these areas, from the apocrine sweat glands, it doesn't have a smell. It's odorless. The problem is when this comes out with the fatty acids and proteins, and it gets broken down by skin bacteria that's on you, the skin bacteria then produces a byproduct that has an odor. So it's not the actual sweat that's coming out. It's because this bacteria on your skin. Now put this all together. That's why we want you to have clean skin so that you don't have the BO. You're getting rid of that bacteria. Your body's going to produce the sweat because it's a natural phenomenon that will happen to cool down your body. But if you keep the bacteria off, then you're going to have less BO. You have deodorants that have an antibacterial part to it too. You see that in when they sell things. It's to get rid of that bacteria on there. Okay? See, practical stuff I teach. Okay? All right, so this is, here's our apocrine gland that is coiled up over here, and it goes right into the hair follicle. But you could have this, it's also called the eccrine sweat gland. They are coiled up here, but it goes right to the skin. So those are the two differences. These are sweat glands over there. All right, this is also fingerprints. It's showing you the pores. If you get really close up to your fingertips, you can see the holes over here are the pores of your, of the openings to the ducts of these sweat glands. Okay? Hair, right? Location. Everywhere except the palms of your hands and the soles of your feet. But it's found everywhere. Okay? It's derived from dermis, and a hair follicle is made up of keratin. That's what that is. It's modified keratin, which means that the hair follicle is waterproof and it's strong. The shaft of the hair follicle, the long part of it, that's called the shaft. And then we have down the part that's actually sticking out of the skin is called the shaft. The part that's actually in the skin itself is called the root. We just have different names now, right? We also have an erecti pili muscle. The erecti pili muscle attaches to the hair follicles. And what happens here is as that muscle contracts, it's going to bend that hair follicle to make it go straight up. This makes your hair stand up. These are connected to a certain part of the nervous system called the autonomic nervous system, which we'll talk about much later. This is what also produces the goosebump. Okay, when the erecti pili muscle gets contracted. So again, here's our hair follicle. So this the hair follicle is all the way here. From this point here down, that's going to be our root of her hair. And from this point up will be the shaft of the hair. We also have a erecti pili muscle that's formed over here. When this contracts, it's become shorter, which means that this hair follicle is going to bend and it's going to go perpendicular with your skin, making your hair stand up. And as it moves up, part of your skin over here, the epidermis, is going to make a mound here. Thus, the goosebump or the goose pimple, that little bump there. And it's because the erecti pili muscles are contracting there. When they contract and relax, and they do that a lot, it produces heat. That's why it causes shivering. But in an evolutionary thing, if we had more hair on our bodies, a cat would be a good example. Whenever they get stressed, the erecti pili muscles will kick on and the hairs will stand up, and it makes it look like the cat is much bigger than what it is. Should, let's say, a dog start barking at it, the cat wants to make it look bigger. So it makes its hair stand out. Does that make sense? That's what's happening with that. We've lost that ability to make us look bigger. We don't have it for this reason. We have it, hair on our head is to make sure that the UV light doesn't really, is protecting our skin. All right? We have eyebrows. Ooh, what's that for? Eyebrows, well, what's happening is here that when you sweat, that the eyebrows will collect that sweat so it doesn't go into our eyes. There's always a reason for things, right? Physiology reflects anatomy. Okay? Hair shaft does determine the hair shape. If it's a round, and we're taking a cross section of the hair follicle, if it's round, then you have straight hair. If it's oval, you have wavy hair. If it's flat, you get curly or kinky hair. All right? Christmas time. You ever see the ribbon that they have, and you take a scissors and you can actually scrape the ribbon is like has these bumps in it. But if you take the scissors or something straight and you straighten it out, before it had these bumps in it, but if you make them very flat, then it curls up and gets kinky, right? That's what this goes on here. You're making it flat and it goes into this kinkiness. The hair gets kinky, gets curly at that point. A hair permanent, which I guess people aren't doing nowadays. Usually the older folks usually do that. But what you're doing is you're making the shaft become more curly. You're rearranging the tertiary structure of the hair follicle. Don't worry about what I just said, but that's what I'm saying. The stripping the straight Christmas ribbon to make it curly. So it's just showing you that if you have it round like this, it's going to be straight. If you have it flattened like this, it becomes wavy, right? That kind of thing. Nails. Nails, they're located where trauma most occurs, right? At your fingertips, at the toe ends, because you're going to bump into them, stub your toe and stuff. So it makes sense to have hardened areas there. So what it is just a nail is just dead stratum corneum that contains a lot of keratin in it. Okay, that's what that is. MUO is made up of. All right, and it makes sense. Again, physiology reflects anatomy. You expect to be having harder things at your tips of your finger because that's the place that's going to be more traumatized. Okay, and the nail bed is made up of a stratum basilae. Okay, now tissue repair. All right, tissue repair. We have two types: regeneration versus fibrosis or scar formation. Regeneration. You ever do like a skin abrasion, like a rug burn, and then about a week later, it goes right back to what it was. The hair grows and stuff. That's regeneration, all right? You can't see any scar there. But if the cut gets deeper, you're going to have a scar there, all right? Fibrosis. So regeneration, here's the steps of it, okay? Regeneration is replacement of destroyed tissue by way of mitosis, all right? So superficial skin abrasions. A rug burn is a good example of that, okay? Where it doesn't go into your dermis. Only in cells that can go through mitosis can do this, okay? So it does not occur in skeletal muscle, cardiac muscle, nervous tissue. There is no regeneration that happens to those. So you can have dead tissue, you have scar tissue over there, which could disrupt the activity of electricity going through that muscle, okay? But these three things over here, if you have any scarring in these areas, it's going to disrupt the electricity going through each one of those muscles. All right? You have a heart attack, part of the heart muscle gets destroyed, you're not going to be able to make that electricity go from one place to the other, so now a certain part of the muscle of the heart is just not going to contract properly. Okay? So these tissues must be replaced with scar tissue, which is a thickened area that electricity has problems going through. So regeneration, you got a cut over here, and the cells will just go through mitosis and just fill in the area. All right? So the basement membrane is still pretty much intact, this bluish area. Okay? Now fibrosis, or a scar formation, a few other steps get involved with this. All right? Replacement of destroyed tissue by fibrous connective tissue. This creates scar tissue. And here's the steps. Fibroblasts multiply in the connective tissue, and when they do, they're going to make more collagen there. Remember, fibroblasts make collagen. Okay? The fibers draw edges of the wound. Where that cut is, it's going to draw it like a contraction. It's going to draw it in. So it's going to create this kind of setup. It's going to draw, if there's a cut going in here, you make a cut, and I'm going to exaggerate a little. It's going to go like this. And now you've got connective tissue or collagen over here. It's going to attach here and on here, and it's going to draw it this way and close it. Okay? That's what's going on here. They're going to draw the edges of the wounds closer together and cause a strengthening to occur more. What happens first is that since it's new collagen fibers, it has this pink color to it. We call it granulation tissue. When I see granulation tissue, pink area, and I'll show you what that looks like, that's telling me it's got some good healing going on. You want to, and you've seen it, when you cut yourself, it's like a raw area. It looks like pinkish in color. That means blood vessels are moving in there when it starts getting pink. Okay? So you have these capillaries that start going in and forming new capillaries in this new tissue. That pink area, that granulation tissue, is telling us that there's good blood vessels that are going in there to bring in a lot of nutrients. All right? So this granulation tissue becomes pink, and a new blood gets perfused in those areas. And the surface epithelium starts regenerating. So this happens down deep, down in the dermal area. But then when it starts going like this, when it gets to the point where the epidermis is going to have the regeneration there. But you'll have scar tissue underneath. Okay? And when you have the blood there, when you cut yourself, it's scab, and the scab will fall off. Okay? So it's just, you got to cut over here, and here's where the two sides are. It's going to start, the fibroblasts start forming in here, or start coming in here, and the collagen gets formed by the fibroblasts, and it starts filling in here. Regeneration is going to happen at the epithelial layer. Okay? So you can have excessive amount of of this granulation tissue, and we call them keloids. And certain people are very prone to getting keloids. You cut yourself, and for some reason their body is programmed to make a lot more granulation tissue than what you expect. And you've probably seen this in people. We see a lot of it behind the ear. Usually when they get an ear pierced, we see a keloid forming behind the ear. I sometimes look at this when I'm in the grocery store and I'm waiting, just waiting to put my groceries on the conveyor belt. I just look at it. I can't help to look, all right? I can't get in trouble for looking. I just happen to see that. When I twiddle my thumbs, I'm not looking, all right? But I see that. No big thing. It's a cosmetic thing. The problem is with keloids is that if you remove it, surgically remove it, you're making another scar there, so another keloid will form. So you're just a keloid former. We just can't get rid of them usually, okay? Some people like to actually use it for tribal, certain tribes, they like to put scars on their bodies on purpose because it's almost like a tattoo to them. And they like to do that, all right? Effects on aging. As we get older, like I said, we decrease the activity of our oil glands, or sebaceous glands. So they get dry skin. Wrinkles. What happens here is that the elastic fibers in the dermis start to diminish. So they just crumble together, right? They bunch up together. And the hypodermis gets thinner. So it's sunken in and creates these wrinkles. All right? The age spots. You see a lot of older people with these dark areas on their face and their bodies. What happens here is that there's an increase in melanocytes in localized areas of the hands and face. So we have, in other words, we have more melanocytes in the hands. Why they're growing there more, we don't know. But they start growing a lot more in the hands and a lot more in the face, which means there's less throughout the whole body. So therefore, these melanocytes that are more copious amount in the skin and of the hands and face, they produce more melanin. So they get darker. You have these spots on the face. You have spots on the hand. And in gray and white hair, this is an interesting thing. I don't know the exact phenomenon here, but there's a decrease of melanin that's produced in the hair. So as you get older, there's less melanin that happens there. Bubbles. I don't know where the bubbles come from, but the bubbles that are in the are also added to the core of the hair follicles, and when this does, it creates this grayness to the hair. So that's what happens with that.